Imagine a company that has its tentacles in every part of the healthcare industry. Chances are that you've never heard of it, but it's there, controlling everything. From drug prices to hospital bills, this company sets the tone and makes the rules. And what if I told you that this company is said to be responsible for 70,000 deaths during the opioid crisis? Hold on tight as I tell you how one company sits on top of the trillion-dollar healthcare industry even after being responsible for America's drug overdose. Who would have thought that a company that started as an importer and wholesaler of natural medicines would become so influential in all aspects of the American healthcare industry? This is the McKesson Corporation, and it's a 194-year-old company with a vibrant history, as you can see from the multiple name changes. McKesson changed its name several times before reverting to just McKesson in 2001. The company started spreading its influence in the medical technology market by acquiring one medtech company after another. Later in 2010, it acquired an oncology and physician services company, helping it spread its influence in cancer-specific markets. And it seems like the oldest operating company in America is not stopping. In 2014, it acquired an international company that specializes in pharmaceutical and healthcare logistics, and this acquisition helped propel themselves to the top. At this point, McKesson has already integrated itself into all the ins and outs of medical practices. Just thinking about everything that they're involved in makes me want to gasp for air. I mean, they have a lot going on. And without us knowing it, McKesson Corp has found a way to influence every aspect of the healthcare industry. And if logic flows right, it has heavily influenced how we receive our healthcare from pharmacies, hospitals, clinics, nursing homes, and even doctors. To put this into perspective, if you've ever been to the doctor or bought a prescription from a pharmacy, chances are that you've interacted with McKesson directly and indirectly. Right now, McKesson Corporation operates in the whole of the US, including some international reach. Its services have reached far and wide, supplying 1/3 of all pharmaceuticals used in North America and employing over 78,000 people. And in terms of money, well, let's just say that you could probably buy quite a few Flintstone vitamins with their total revenue, because their total revenue for 2022 reached a staggering $264 billion. And well, if you've been doing business for 200 years and you're not rich, then you're probably doing something wrong. Or you're perhaps doing something wrong that's made you rich. And to be honest, this company isn't all rainbows and butterflies either. Sometimes the most prominent players trip, but it's a different story when you're the most significant player in the healthcare industry and you make a big mistake with drugs. That's right, McKesson made some terrible mistakes and the alleged error killed hundreds of thousands of people. Or was it really a mistake, or was it intentional? Well, let me get into that. As I mentioned in the previous chapter, McKesson has its tentacles in all parts of the healthcare industry, including the manufacturing and distribution of medicine. This means that part of the drug list they supply is painkillers, and opioids are one of them. An opioid is a drug used to help ease the pain, and this drug is given to people who experience pain from various illnesses, but it has gotten to a point where the use of this drug has been abused, and the abuse leads to countless deaths. Opioid overdoses have caused more than 500,000 deaths in the US in the last 2 decades, and 3 drug distributors are being held accountable for this. One of the big 3 is McKesson, which has faced multiple trials for multiple reasons, often ending in hefty fines. The funny thing is though, even when served lawsuit after lawsuit, the company does it all over again. I guess the penalties are not as hefty as the profit, eh? Lawsuits have also been filed against pharmacies and physicians to address inappropriate prescribing and dispensing of opioids, but all of these are just specks of reality, because the fact is that the opioid crisis started from the manufacturers and distributors, and that's where McKesson's role comes in. It's also been found that manufacturers and distributors, including McKesson, failed to put an addiction warning in the drug packaging and promotional activities. Also, McKesson released opioid drugs that were defectively designed, saying the narcotics were safer and had the lesser potential for abuse. And the worst thing is that it isn't easy to prove in court because it's FDA approved. So what happened there, FDA? Eventually, the FDA did intervene and put more warning labels, but by the time they implemented this, a whole new industry was in place. People are already misusing and are addicted. Prescriptions have skyrocketed and black markets have formed. I'm actually stunned upon learning this, especially since this neglect of details has led to hundreds of thousands of deaths and a more widespread epidemic that's even trickier to suppress. To give you some perspective on the US opioid epidemic that McKesson helped fuel, let me give you some details. So between 2012 and 2015, 4,400 Kentuckians died of opiate overdoses, and the authorities have pointed their fingers at McKesson. Several investigations later, they had solid cases that McKesson knowingly flooded Kentucky with large volumes of opiates amid the state's growing epidemic. So for 7 years, Kentucky has struggled to identify how the pills are oversupplied. In those 7 years, though, deaths due to overdose have been going around like the flu. In West Virginia, it's alleged that between 2006 and 2014 that McKesson delivered more than 120 million painkillers to pharmacies, and that's roughly around 142 pills per year for each man, woman, and child in the area. Just an absolutely ridiculous amount, as West Virginia became one of the hardest hit states in the opioid epidemic. And Cabell County, an area in West Virginia, has an overdose death rate 5 times the national average, and it's distressing to know that this isn't the end, because every day the lives of many children, men, and women are changed due to drug abuse, and authorities in medical and law enforcement struggle to suppress the rising casualties from painkiller overdose. But what's even sadder is that people are dying because nobody seems to care anymore, says Martin West, a sheriff in West Virginia. The situation has just gotten too big to handle, and sometimes when something gets overwhelming, people just tend to shrug it off. And if you aren't in the US, or maybe haven't been in a situation where drug overdose is blatant, then I need you to picture this, because right now it's just a statistic to you, maybe a number or a chart, but it's actually very traumatic to the people dealing with the greed and neglect of these giant companies. The deaths have become normalized, and the situation is exceedingly bad for frontline workers. So if you haven't seen what an overdose situation looks like, then it looks like this. So now you've seen the photos, and that's what people look like when they overdose on opioids. But when they aren't overdosed on oversupplied drugs, they look like regular people with families and dreams, and most of the time promising careers. Pretty much just like you. But everything is ruined for you by addiction fueled by Big Pharma's dangerous pursuit of profits. Also, stop with the bull reasoning that an individual decides to acquire and use illegal drugs, and it shouldn't be the Big Pharma's fault if you choose to, right? Well, sorry to burst your bubble, but there's a fault in that reasoning. Big Pharma like McKesson uses this fact to their advantage and to make a fool out of you, because once you get a taste of something addicting, then there's no stopping you. The Big Pharma supplies more once the addiction has set off and pretend like they didn't do anything terrible. Well, let me tell you what McKesson told West Virginia when they sued the pharmaceutical company. We are just middlemen in the pharmaceutical supply chain. The thing is, though, McKesson is not just a middleman in the supply chain. They respond to the demand, but sometimes demands are alarming, and McKesson fails to report these suspicious orders. There is a law that requires drug distributors to control and report any illegitimate orders, and the company was deemed too lax in its obligation to monitor these procedures. What's even more bothersome is that the company washed its hands of anything related to oversupplying or misinterpreting their product's addictiveness. But they can't wash their hands too much, as it's apparent that they're reaping all the benefits from submerging America in opioids. While the government is spending $78 billion of resources to manage and counter the opioid crisis McKesson has fueled in past decades, McKesson has doubled its revenue in the meantime, from $106 billion in 2009 to $238 billion in 2021. In the past year, McKesson was even ranked number 7 on the Fortune 500 ranking of the largest corporations in the US. And apart from the many sectors of the healthcare industry that they dominate, its main source of sales is, well, you can fill in the blank. To prove that McKesson knows what it's doing, countless cases were filed against them, which they chose to settle with money. And when I say myriad lawsuits, I mean thousands of lawsuits combined. And McKesson will pay a couple of $1 billion to the states. So at this point, I'm still unsure if justice has been served because even as of recording this video, no company admitted wrongdoing on their part. And I'm not sure how to feel knowing that they used money to settle these cases because the settlements represent real accountability, said one of the attorneys who handled the case. By the way, the settlements will be used to fund programs and services to help ease the burden McKesson caused to families and communities, and I'm crossing my fingers that the money will be put to good use. Now that you know about McKesson and the scope of its power, especially one of the biggest problems facing the US, how does it make you feel that you didn't know this company has been around you, shaping and molding how you received healthcare? And what do you think about these ultra big companies like McKesson controlling the way we live?